And hello to everyone who is joining us. We will just give it a few more seconds to get everybody in before we get started. All right, so I see the participant count is stopped increasing, so I think that's a good sign, and I will kick us off. So welcome everyone. We are thrilled to have you today on our webinar on criminal justice during COVID-19 and how to better prepare for the next time. My name is Ann Kelsey. I'm a staff attorney at the Center for HIV Law and Policy and a member of the COVID Justice Coalition. The COVID Justice Coalition was founded last summer in August of 2020, and we are a coalition of advocacy groups and individuals who meet and work together on COVID-related issues as they affect the justice-involved population here in the state, and as it relates to governments, both government agencies, state and local, and the correctional system itself, as well as reentry issues, because certainly it's not just in prisons and jails that this is affecting all of us, but we also need to look at reentry as the community as well. For more information about the COVID Justice Coalition's work, you can check out the website at fortunesociety.org/advocacy. And if you're interested in joining our listserv, please contact Rebecca Engel. And Rebecca, if you want to put your email address in the chat, it is rengel@fortunesociety.org. But again, we'll put that in the chat and we can also read that out again at the end just to make sure that everyone has it. We certainly welcome any interested members or groups to join us. I'd like to quickly just welcome and thank our great panelists that you're going to hear from today. Lucas Mark, Senator Julia Salazar, Dr. Robert Cohen, and Alexander Lesman. Andre, who I'll pass it over to in a little bit, will do the full introductions, but just know that you guys are going to hear a great panel, and we are just really excited to hear from them. I would also like to thank the Fortune Society for facilitating both the coalition and hosting today's webinar, in particular, Rebecca and Andre, who will be doing the work today. Rebecca will be manning our chat box. So please feel free to put in any questions or comments you might have. And Andre will be doing the facilitation of our discussion. And so I will be passing it to him shortly. But before I do, I just want to kind of give us a quick overview and some themes for today about where we are as COVID relates to our criminal legal system. So when I checked the docs numbers last night, and this is some of the little data that they publish. They report 6,600 confirmed cases among incarcerated people, 6,500 approximately of whom they say are recovered, 5,000 confirmed cases among staff, and 383 confirmed cases of COVID among parolees. They report for deaths, 35 deaths among incarcerated people, 8 staff deaths, and 9 deaths for parolees. But I think it won't surprise anyone or be a controversial statement to say that these numbers are likely very low and underreported just due to late or inaccessible testing, not testing asymptomatic cases, data reporting issues. So I think we should take those numbers with a grain of salt. In addition to confirmed cases, right, we're also looking at what vaccines look like today and really the low vaccination rates that we're seeing. So the numbers that were last reported was that about 46% of incarcerated people in New York in the state system have had at least one vaccine, whether that's the one shot Johnson & Johnson or the first shot of the two Moderna vaccines. And that docs has completed a clinic at all facilities, which means in their organization, they believe that everyone has had at least the option to choose to be vaccinated. Docs has also reported that a little over 8,000 staff members, correctional officers, have been vaccinated, which by my math is about 30%, although that could also be an undercount because Docs is not requiring that correctional officers report if they've received the vaccine publicly. So those are numbers, very low vaccine rates, particularly compared to, some other states who have really prioritized and focused on getting the incarcerated communities and facilities vaccinated in their states. So those are the numbers, and then to some themes. So the first one, and this may be kind of a more obvious statement now than it was even a few weeks ago, but COVID isn't over. Cases are continuing to rise both in New York and around the country as we deal with the Delta variant and as we deal with low vaccine rates in some communities and areas. And so it's still amongst us. So even as we look back and we look forward, we need to look at today as well. Not only is COVID still with us, but we're really just starting to understand what the long-term effects of COVID could be in terms of long COVID. COVID has been described as a mass disabling event. And for a country where we already struggle to provide healthcare and access to people with disabilities, this is a real troubling development. And I don't think we as a society have grappled with how we are going to care and support people who are suffering from long-term effects of COVID. Not only is COVID not over, but COVID isn't the first or the last pandemic that we will face and that our prisons and jails will face. Prisons and jails have had to deal with tuberculosis, with HIV, with MRSA, which is a antibiotic-resistant form of bacteria. And so as we think about COVID and grapple with COVID and how to, prepare for a future COVID, we have to understand that that's not enough. And we need to also think about, what the next pandemic might look like, how it might be different, and what processes we need in place to deal with a new and different kind of pandemic that will come. And that's just the reality. Related to that is the fact that mass incarceration itself is a public health crisis. Too many people, too many government officials think of prisons and jails as, kind of a separate other, not connected space of where health issues and people can be isolated. But we know that's not the case. Whether we ourselves are an incarcerated person or formerly incarcerated person, whether a loved one or family member or friend is, or whether we are just a community member or ally of these people, what happens in prisons and jails affects our communities and vice versa. So as we think about what a public health solution looks like, the carceral system has to be an integral part of that process. And more so because as public health experts have explained over and over, prisons and jails are really epicenters for disease to spread. As congregate settings with limited access to hygiene supplies, cleaning supplies, social distancing experience. They're really just an ideal setting for infections to spread. And so when we think about disease and infection control, prisons and jails are really, really critical. And our experience with COVID has shown that outbreaks in prisons and jails does clearly affect the community, and data both in other countries, cities, states, as well as in New York, have tied outbreaks in prisons and jails to outbreaks in the community. And lastly, sort of the last thing to think about is in this lens of mass incarceration as a public health issue, is that incarceration itself is also disabling. People leave prisons and jails too often less healthy than when they went in, due to poor healthcare, stress, trauma. Studies have shown that incarceration will lower lifespan. Public health officials have suggested treating people who have been incarcerated as chronologically older than they actually are, just due to the serious health effects of incarceration. And these issues of poor health care, poor treatment, poor food, all of these long predate COVID. Just that COVID has really shone a light on this terrible situation. So all this to say that is really critical that we do a better job protecting the rights of incarcerated people, protecting the health and health access of incarcerated people. And that's why we're here today. And I hope that we all, especially our great participants who have joined us, I hope we all leave the webinar today with more information and some ideas and steps about how we make these improvements to health and healthcare in our prisons and jails. So with that, I will turn it over to Andre to get us started. And as I mentioned, Rebecca is manning the chat function. And so please put your questions in the Q&A box or comments in the chat function, and she will get those to Andre as much as she can, although we might not be able to get to everyone. And so we certainly hope this is only the beginning of this discussion and that we can all meet again in the future, because we certainly welcome everyone's input. Again, thank you everyone all for coming, and I'll turn it over to Andre. Thanks, Andre.
Yes, thanks so much, Anne, for that. I think it's super important that people understand the data, right? That summary that you gave is critically important for people to understand exactly what the numbers are. The numbers, although they can be fudged at times, and to your point, oftentimes underreported, it's important that we get a sense of what some of those numbers look like, the importance of what we need to do to make sure those numbers change, right? And through this panel, you're going to hear information that can inevitably help you to understand and become part of this coalition to amplify the need to make sure people have proper access to the healthcare treatment that they need during COVID-19 and in future pandemics. And so we're very excited that we have a number of people who have joined this Zoom call today and this webinar. We want to acknowledge all of the other advocacy groups who are doing some semblance of this work, either through advocacy work that they're doing through various bills that they look to push to get legislative wins on, or those just simply speaking with the community about this issue because they may have loved ones that are incarcerated. And so we want to thank all of those groups and individuals who are doing similar work around amplifying the issue around COVID-19 now and in the future, and how do we deal with those things. So we have an illustrious panel here. We have people that are very dedicated to this issue, who've taken the time out today to make sure that they're present to let you know they join with us in collaboration to amplify these issues. So we're really grateful for our panelists. And so our panelists, obviously, before I get to them, my name is Andre Ward. I serve as the Associate Vice President of the David Rothenberg Center for Public Policy at the Fortune Society. I work with Rebecca Engel. Together, she is the Senior Policy Counsel with the coalition, the COVID Justice Coalition. And like Anne said, it's made up of many different organizations, all of whom have an equal invested interest in making sure that this issue is amplified and kept in existence and doesn't go away. Because if we don't sustain our efforts to keep this in existence, it will get worse. And then in future pandemics, there will be no solutions nor recommendations, right, to put together actions that will make sure that the conditions for people that are incarcerated or detained are right and humane. And so we're going to get to our panelists. I'll give you some brief introductions, then we're going to jump right in because I'm super excited. Been waiting almost 30 days, right, to hear from our panelists, some of their thoughts. We've developed questions for them. Our first panelist, obviously, and then I'll just read all of their bios in order, so this way you can know who they are. Then we'll jump to questions for all of them. We have Mark Lucas, and Mark Lucas is someone who's directly impacted. He's joined us today. Before we had someone else that was joining us who was directly impacted. They were unable to make it, but we hope they're safe and well. But Mark Lucas is a student at the Outreach Training Institute where, for the last 3-4 months or so, he's been studying to become an alcohol and substance abuse counselor. And so really big up to him for doing that work and wanting to engage in that effort. Our folk who have substance use issues and treatment needs relative to that need counselors, right, and peers who can support them right through their journey of obviously healing and addressing their addictions and recovery. Lucas obviously has a goal, right, to become a human services counselor to others who struggle with addiction. He currently lives at the Freedom House at Fortune, which is a transitional services housing program that opened up. And he was detained on Rikers Island from from December 8th, 2020 to February 9th, 2021. So he was on Rikers Island during the time of COVID, and we're going to hear from him based on a few questions on what his experience was like as a directly impacted person. And then we have as another panelist, she's obviously no stranger to the advocacy world and social justice world. You can hear her raising her powerful voice in many different spaces, uncompromising, unyielding, bold in many different instances. And that's none other than Senator Salazar, Senator Julia Salazar, to be more specific. Senator Salazar represents New York's 18th state Senate district, including Brooklyn neighborhoods of Bushwick, Cypress Hills, Greenpoint, and Williamsburg, as well as parts of Bedford-Stuyvesant, Brownsville, and East New York. Interestingly enough, East New York, Brownsville, some of those areas are a part of those 7 neighborhoods. Well, it's really 7 to 10 neighborhoods wherein people are actually being pulled out of those neighborhoods to upstate prisons, 75% of which. And so we're thankful that Senator Salazar is representing those communities most impacted by the criminal legal system in prisons. She's also, right, upon her election in 2018, she became the youngest woman elected in the history of New York State Senate. I'll say that again. She became the youngest woman elected in the history of the New York State Senate, which is a huge accomplishment on behalf of people that identify as women. Senator Salazar is the chair of the Committee on Women's Issues, as well as the Committee on Crime and Correction. And then we have Dr. Bobby Cohen. Dr. Bobby Cohen is a physician in practice in Manhattan. He worked on Rikers Island as the director of the Montefiore Rikers Island Health Services. He served as the vice president for medical operations of the New York City Health and Hospitals Corporation, as a director of the AIDS Center at St. Vincent's Hospital. He also has served as a federal court-appointed monitoring, overseeing medical care for prisoners in Florida, Ohio, New York State, Michigan, and Connecticut. And Dr. Cohen obviously is no stranger to this work, is involved in a lot of criminal legal reform issues as it relates to health-related matters, and then just generally speaking. So we have Dr. Cohen who joins us. And then we also have Alexander Lesman, who we affectionately call Alex, for those of us who call him Alex. And so Alex Lesman is an attorney in the Special Litigation Unit of the Legal Aid Society's criminal practice. He's defended people charged with state and federal crimes, and also has experience working on issues that arise in jails and in prisons. And since last fall, Alex has served as Legal Aid's criminal practice coordinator for pandemic-related work. And again, Alex has really been a core part of the COVID Justice Coalition. His knowledge and expertise and just his insight helps guide some of the work that we do there. And so Alex, Dr. Cohen, Senator Salazar, Mark, thank you all so much for joining us on this really, really important panel to talk about this really, really important issue. And so we're going to start right off too with you, Mark, just with some questions. just describe to our viewers and our listeners your experience within jail during COVID-19 pandemic. When and where were you there, and what did you observe and what did you experience?
Well, first, I'd like to say thank you, Andre, for having me, and to Rebecca Engel for giving me the call to appear at the last minute, and for the entire panel for doing the work that you guys do for COVID-19 and better preparation for next time. So thank you so much. Can you hear me?
Yes.
So I entered the Rikers Island on, I believe, December 8th, and one of my greatest fears, because I was violated by parole, one of my greatest fears was, contracting COVID-19, because I had heard, even while I was on the street, that, the COVID-19 situation in the prison system was basically out of control. And so that was one of my concerns entering Rikers Island. I never contracted COVID-19 on Rikers Island, and I'm very grateful for that. But the environment was such that it could be very easy to contract it, in the sense, like when I first came through, the overly packed cells that they have you in. I mean, we're talking about like everybody's on the floor, people are shoulder to shoulder. They take you from one cell to the next. When you finally do get tested, they put you back in the same cell with people who have not even been tested before. And if you have a negative test, if you go back into a cell where other people haven't been tested, you could be re-exposing a person who has a negative test to someone who may be positive. And so there was a lot of that going on Rikers Island, just the inability to separate and to keep things in a proper perspective so that you don't get that spread going on with COVID-19.
Thank you for that. And I want to shift right now to Senator Salazar. Senator Salazar, you've been amplifying this issue in different ways as a part of your work as an elected official. First, can just tell us why, Senator Salazar, this issue of COVID-19 in New York was important to you?
Absolutely. Thank you, Andre. Really appreciate the opportunity to talk about this with you all. So as you mentioned, I represent neighborhoods in Brooklyn. I live in Cypress Hills, East New York. Our communities in the northern and eastern parts of Brooklyn have been among the communities that have been hit hardest by both the health impacts and the socioeconomic impacts of the coronavirus pandemic in the entire country. And additionally, a disproportionately high number of individuals, as you also mentioned, who are incarcerated in jails and prisons across New York State are actually from right here in Brooklyn. The largest percentage of any borough in New York City, of any area, those are the people who end up incarcerated in our state. And so as the chair of the Crime Victims, Crime and Correction Committee in the State Senate, I'm very dedicated to confronting the issues that incarcerated people are facing, and very grateful for the critical work that the COVID Justice Coalition is doing in seeking to improve the health outcomes and conditions in jails and prisons in our state. But I really care deeply about this, not only because of my position in the State Senate, but because this is my community. It's the communities that I represent that are impacted the most, both on the outside and on the inside of facilities.
Absolutely. And thank you for that, Senator Salazar. And then want to transition to Dr. Bobby Cohen. As a doctor, what has been your perspective on how Doc was handling COVID during the last year and a half? And what about, just some thoughts on that as a doctor, as a physician?
Thank you, Andre. Can you hear me?
Yeah, we can hear you. And for our viewers, Dr. Cohen is having some challenges with his video, so you won't be able to see him.
Yeah.
But you can obviously hear him, and we can hear you, Dr. Cohen.
I apologize for that, Andre. I've a flicker I've not seen on Zoom before. Thank you, Andre and Fortune and all for inviting me to participate. As a doctor, I remember a lot. I remember back in 1981, and when I worked on Rikers Island in 1981, I was a physician there, and I was soon became the director of the health services. And I remember how the Department of Corrections and how the health services responded to HIV infection. And when I heard of COVID, when we all heard of COVID, I mean, our first thing was to keep our head in the sand. Of course, we could not believe what we were about to encounter. But with HIV, we knew that it was going to affect the people living in the jails and prisons, and we did a lot of bad things. We treated people very, very poorly. Security staff wore hazmats. Judges didn't allow people into their courtrooms, and we isolated people because they had HIV and living with HIV infection, and we never let them back into the facilities for quite a while. So I think I remember that, and I learned something from that. We all did. The names of people being transported from the jails to courts were written in red crayon in the receiving rooms. It's a bad time.
Sure.
Also, another analogy here, I think, is hepatitis C, another epidemic disease for people in jails and prisons. I think because of litigation and because of families' demand and because of incarcerated persons' demand, there's better access to hepatitis C treatment, which is also a curative treatment. But there are, in the state, the state's numbers are 7.5% of people are positive with hepatitis C, and 23% of women in the state system. And it's worth noting that in the state publication a couple of years ago of docs, DOCCS, they said the most difficult obstacle faced providing hepatitis C care and treatment is the lack of providers needed to oversee the work, prescribe the treatment, and ensure appropriate monitoring and follow-up to take place. At this time, health services has high vacancy rates, clinical physician 2 vacancy rate of 21%, nurse practitioner rate of 20%. I just raised these issues. I don't know the current data, but I would not be surprised if these same issues of lack of availability of sufficient healthcare to do the job, sufficient health professionals to do the job, is an important issue. I'm sure Senator Salazar, very nice to meet you, and I hope at some point we could work together on investigating that issue. And also in the DOCCS report, cost was a challenge. They particularly mentioned as hepatitis C treatment is expensive, but hepatitis C, people with hepatitis C need treatment.
No, absolutely.
So COVID, in my experience, is mainly on Rikers Island. I'm a member of the Board of Correction, and the board and the CHS, Correctional Health Services, in the 3rd week of March called for mass discharge from the jails. And of course, that is the overwhelming issue. Lucas, you mentioned it, I think, and just decarceration is the fundamental solution to COVID in jails and prisons, because I'm so glad that you did not get it, Lucas, but essentially almost everybody who lived and worked in the prisons and jails of New York State were infected or were almost infected. And of course, they brought that infection back into the community with them. I think that the city released about 1/3 of the population in the first month, and that made a tremendous difference. I would just point out that the populations that were present in March and April of 2020 are the same as the populations that are in New York City jails right now, although the new commissioner is committed to decarceration. All of the things that were done a year and a half ago, release everybody over 55, if at all possible, release anybody with health conditions which put them at particular risk of being seriously ill or dying from COVID, release people, in your case, with temporary parole violations, technical parole violations.
Sure.
You didn't get released, but that was a category. And I think those, I know that, I hope that those are being reconsidered right now, but it's not happening.
Right.
And there is still a pandemic, not great, not as great as it was a year and a third ago, but may be getting just as bad coming up. And the city should, and the state should be releasing as many people as possible, particularly anybody who is at high risk of developing serious illness or being hospitalized because of COVID. It's not happening yet. It should happen as soon as possible. The couple of other
Dr.
issues.
Cohen, Dr.
Yes,
Cohen, I just want to, because we got some other questions. I'm definitely going
sure.
to circle back to you.
Oh,
I
that's
want to
fine.
kind of move this along for the sake of time too. And again, I'll circle back to you because I had some more questions for you, Dr. Cohen.
Okay, thank you. Thank you very much.
And so we want to circle to Alex now. And, Alex, like looking at both the New York State and nationwide, like what were the social movements that emerged from the COVID-19 experience?
Thanks, Andre. And thanks for everyone else for participating. I should say off the top that my views are my own and do not necessarily reflect the views of Legal Aid Society. Well, the national picture and the picture in New York were similar in that there was a lot of alarm in certain quarters at the beginning of the pandemic about these tightly packed environments, jails and prisons, and what was going to happen to people living there with this highly infectious disease. And I would say that they were also similar across the country in a relative lack of success. And I hate to be negative, but I think that's fair to say that not a lot was achieved from essentially grassroots advocacy. There was certainly an awakening among a lot of people that there's horrible conditions behind bars, that healthcare is inadequate. But I think generally it was swallowed up by larger anxieties about the pandemic in the rest of the world and in the free world. And political pressure was hard to focus for most of the pandemic. That's not to say there were no successes. I think there were scattered successes, but outside of a few sympathetic journalists and a few courageous public health officials, there wasn't really a huge amount that I saw that was achieved by these movements.
Absolutely. Thank you for that, Alex. Then want to turn to you, Mark, too. Want to circle back to you. As you notice, right, our viewers, we're circling back to each of the panelists back and forth and raising these questions. But one of the things we really wanted to know too from you, Mark, is that, were the things that were supposed to be happening, right? Like the use of PPEs and social distancing and COVID testing, was it actually happening when you were on Rikers Island? Were correctional officers wearing masks themselves?
Well, in regards to one of the things that me and a few other detainees was complaining about to the captains were that they were not following the COVID-19 CDC protocols that we knew about while I was incarcerated. I mean, you literally have some people in there that didn't want to catch it. They were in fear for their lives. And the only way we thought we can do something about enforcing any type of, rules was to talk to the captains. And no, they were not practicing social distance. The social distance signs that are supposed to be on the floor were not there, the 6 feet distance. In regards to how the beds are situated, you can have like 70 people in a dorm, 60 people in a dorm. The beds are about 2.5 feet away from one another. So what some concerned detainees were doing is that they were skipping the other bed. They wouldn't let anybody like to the bed to their left or to the right sleep next to them because it wasn't sufficient enough in distance, minimum 6 feet, right? And so the administration had a problem with that. And they were saying, no, let these people in, because we got to a point where, people didn't want to let new detainees in because they were just crowding the dorm and not respecting the social distance. So you had that going on. In the mess hall, there's no social distance. They're not practicing that. They're mixing houses, even houses. I was in OBCC, the Otis Banton Center. And, there were some officers who were wearing their masks. You know, there were some people that were trying to do, you know, what they needed to do, but the situation was just so overwhelming. You know, if they did wear a mask, it was below, you know, below the nose. And, you know, that's not a proper way to, you know, wear a mask, right? And you're in the dorm and it's below your nose, or you want to talk, you pull it off. So the social distance was one of the issues that some of the concerned detainees were having. And I was definitely one of them. I was advocating for that, you know, in the proper way. So COVID testing actually, so yes, the COVID testing was happening. I do want to say that they were definitely testing people for COVID, but I think that, now I'm no scientist, but I think that the time span and how they were doing it. So let's say you were tested when you first came in. Now they mixed you with, you didn't know the status of the other people they were throwing you back in with, and they had just come in. Then they shift you off to a dorm. So you could have contracted it while you just left another cell with people with statuses that were unknown. So now you're in a dorm. So they come back 3 weeks later to test you. So I just think that, you know, that's too far in between to be regularly testing people. And we were like 3 weeks, you know, that's just a long time. You'd be dead by then. I mean, if you had contracted it, you'd be seriously sick. You know, so those were issues of concern, you know, for those people who were willing to advocate respectfully for themselves. And so, yeah, some officers were wearing masks and some of them weren't. You know.
Yeah, thank you for that honest feedback, because this in no way is to upbraid the correctional staff that are there, nor to say, like, got you, right? That's not the issue here, but we want to make sure that the issue is raised, right? If we have some bad actors, folk who are not practicing that, who are in the positions of authority, they have to obviously be held accountable. And I know with the new commissioner, Schiraldi, and first deputy commissioner, Stanley Richards, right, they're going to look at both sides, make sure there's equity and that everyone has dealt with humanity and that people are practicing what they need to. And so turning to you, Senator Salazar, you know, what were the major problems that you saw occurring in New York around COVID-19 and the vaccine in particular? And like, what about, you know, this criminal justice system in particular?
Yeah, absolutely. I may need to kick out my dog. My dog
That's
is
okay.
making sounds. But yeah, I mean, especially in New York, vaccine hesitancy is a major challenge still at this point, and that's not unique to docs and to the carceral system. Initially, there was a deeply inadequate vaccine access universally, and a rollout in vaccine eligibility that happened earlier this year. Initially, it was too slow and it was not equitably accessible to people. A lot of progress, tremendous progress has been made since then in making the vaccine equitably accessible. We always need to be doing better at educating people about the vaccine and dispelling myths, and making sure that people have the right information and that they know that it is safe for them to receive the vaccine. But in New York, incarcerated people were among the last populations to become eligible to receive the vaccine, even though we know they should have been among the first to be eligible. Epidemiologists, experts, people like Dr. Cohen were urging that the roughly 50,000 people in correctional facilities across the state should be made eligible because of their uniquely high risk for contracting and spreading the virus, because it's virtually impossible. It's very difficult to socially distance in the general population in facilities. And so it's just that much harder to prevent the spread of the virus. And so it only was after a very damning ruling that was issued by a state Supreme Court judge in the Bronx that demanded docs begin offering the vaccine to every incarcerated person. It was only then that docs began to administer the vaccine more widely, not just to seniors and to people with serious health conditions, but it was only then that they began to administer it more widely to incarcerated individuals. And that wasn't until April. Now it's July. And the percentage of those who are fully vaccinated in New York's jails and prisons is still significantly lower than it is outside of the carceral system. And so we really have a lot of work to do. It was shameful that there was a delay. And I think now the responsibility is to make sure that the vaccine is made available to everybody who is willing to receive it, who's incarcerated, and also that we're doing the education that's needed in order for people to choose to get the vaccine.
Absolutely, Senator Salazar. And we want to transition, Dr. Cohen, following some of what Senator Salazar just framed, how should Doc be responding to the general levels of distrust of the incarcerated population towards medical personnel? Should they be using outside providers for either training or medical care or both? During the HIV and AIDS epidemic at the time, right? There was this huge scare, et cetera. But then there was an introduction of some educational programs in New York State prisons, particularly like the PACE program, Prisoner AIDS Counseling Education. So talk a little bit about that, right? How should they respond, like, to general levels of distrust? And again, should they be using outside providers for either training or medical care?
Yeah, I think that there's not really time to sort of bring in outside medical providers, but they certainly should bring in outside health educators from not from the Department of Corrections, but from the State Department of Health and the City Department of Health, and this is for both the staff and for the people who live there. The fact that people in New York State and throughout this country don't understand how important for them and their loved ones to receive the vaccine is an issue which none of us no one is ignoring, but has to be addressed by education. I think additionally there should be requirements for vaccination for staff, and that will save lives. Absent requirements for people who don't immediately get vaccinated, there should be regular testing, and that's sort of gone on for the whole pandemic of staff, clinical and security staff, to make sure that people who were infected don't come into the facility. Back in March and April of last year, the CHS in New York City did a study, which they didn't publish for a year, which showed that there was tremendous asymptomatic spread of the disease. And everybody, we didn't all know it at that point, but it did happen. And I think that the staff have to be tested regularly until they are vaccinated. I would additionally bring in outside people for that. Again, I just want to Mark's point about density is really critical, and the state and the city have failed to do what needs to be done to assure that there is adequate distancing, and the departments of health were not supportive of that, I think, in the state and the city, and they should be going forward for the next time we run across this. It is not reasonable to have, as I saw, and as Mark saw, 95% capacity being used in dormitories. People were barely 3 feet apart, and the city knew about that. CHS knew about it. They did not criticize it. And going forward, that's very important. Of course, that's related to decarceration, but that's everything is. I hope I answered your question.
No, thank you for that too, Dr. Cohen. And, Alex, transitioning to you, we think about, just like in terms of the legal system's response to all of this, and, what in general was the response of the legal system, and, were there any specific cases that you know of that made a dent in the correctional COVID-19 response? I know Senator Salazar may have touched on it, and that may jibe with some of what you may answer, but talk to us about that, Alex.
Sure. Well, speaking of density and the need to reduce it, legal aid and other legal advocates were entirely on board with that approach that was coming from public health officials. And we realized right away that there was going to be heightened risk inside jails and prisons with high populations. We argued, in fact, for trying to thin out populations all along the chain of events in the criminal legal system. So we argued for fewer arrests, fewer pretrial detentions, typically based on bail being set, We argued for early release from city jails. We argued for early release from prisons. And it was all in the spirit of creating a less dangerous environment inside these facilities. And how did we do? Well, mostly we were disappointed. It was harder to get people out. I would note the further along they were in the system. I think we had maybe some small effect on the low-level arrests, and we had a little bit of success by way of a petition in Manhattan to get vulnerable people out, and it was what they call a mass writ of habeas corpus, and that was successful for about 100 people in the first few weeks of the pandemic, but mostly we lost. Mostly we did not get people out who had been, lawfully placed in jail and prison according to the system. And, that was, I think as a political matter, that was, because of people feeling very constrained. Judges and elected leaders are only human, of course, and they were often reluctant to undo something that the larger system had done.
Yeah, thank you, Alex. And turning to you, Mark, right? We want to ask you too, did you receive any information, right? Or education about COVID-19 and the vaccine? Did anyone inform you of the case that like Senator Salazar had referred to about the Supreme Court judge decision and ruling that it came down? And which vaccine did you receive?
Yeah, thank you for that. No, I didn't receive any information about the COVID-19, about COVID-19 in general. Usually when you come into the system, they give you your going kit, you have the blanket, you have this, and you may have something for medical. And I did not see anything that talked about COVID-19 and raising awareness. I heard of the case of, incarcerated individuals able to receive the vaccine because of, their status and their vulnerability to contracting COVID-19 because of the density in jails and this and that. I learned that information from other detainees who read about it through their, sources, right? Usually it's a family member in the street or someone they just spoke to on the phone. So that information was given to me through them. And, we saw the paperwork on it. And that's when, we started talking about, hey, listen, can we get the shot? And, the administration was saying, no, it has to go. The administration has to get the staff, first the captains, the COs, and then it goes down to the inmates, so they kind of put it like all together, and like we were kind of waiting in line to kind of do that. So yeah, it was tough. I wanted the vaccine, but I never got it there. I received the vaccine when I came into Freedom House, a transitional housing by Fortune Society. I received the vaccine here because Fortune Society made it made you aware of COVID-19, and they provided avenues by which you can have that test done. I wanted it done immediately. I was very fearful that I might could contract it in the future. So I got the Moderna, so I'm fully vaccinated, and I am thankful for that. But to the point of Bobby Cohen, he mentioned something about asymptomatic. A lot of people who were incarcerated, they were asymptomatic. And I was working on Rikers Island, doing changing, uniforms, because they make you wear uniforms. They take your street clothes and they give you uniforms. And so, and this is what we're talking about, just not informing people about what's really going on. So I entered the dormitory, and I was passing out clothes. And when we were done, the officer made a comment about, those COVID-19, such and such. And I was like, whoa, they were infected? And she's like, yes. So the whole dorm was asymptomatic, right? And now here, me, a person who is not infected, like you allowed me to go into a dorm without letting me know that I was possibly going to be exposed to COVID-19. I just was outraged by that. And I quit my job. And so, yeah, so.
No, I think that's a very important point to highlight, right? Because here it is, you're working to support cleaning the uniforms of the people that were there, all of whom you said were asymptomatic. And, yet you were doing this work and it wasn't revealed to you until later on that that was the case, which is a very interesting point to note and ties into this idea of education and awareness, et cetera. So turning to you, Senator Salazar, again, you've been an advocate for many, many years, and again, always amplifying issues. And I know as a legislator, as someone who works in the public space and is in a position of public trust, right? Sometimes it's challenging to advance ideas among your colleagues, right? Sometimes, and what kind of legislation did you write to address some of those problems surrounding that? And what was the reaction from some of your colleagues?
Yeah, there was legislation existing before the pandemic that really became more relevant, as Dr. Cohen mentioned, amidst a crisis like this, the most meaningful, impactful step that we can take is to substantially reduce the incarceration rate and the number of people who are needlessly being held in New York's jails and prisons. And that's the result of both harsh sentencing norms and an unjust parole system that New York has, even the third largest number of people who are currently serving life sentences of any state in the country. And the majority of whom the majority of whom are from Brooklyn. There are two major bills in the state legislature right now that should be passed in order to change that and to implement parole reform and to release people. One is the Fair and Timely Parole Bill, Senator Rivera's bill, which would ensure that the parole board has to release people who are eligible for release on parole unless they pose a present, current, unreasonable risk, and that one that cannot be mitigated by parole supervision. So in other words, not just basing a parole denial any longer on the crime that someone originally committed, that wouldn't be sufficient reason to deny someone parole if we were to pass this legislation. That would really open up a true opportunity for parole to a lot of people who have had to go in front of the parole board multiple times, have been incarcerated for a very long time, and who really deserve the chance to be released. There's also the elder parole bill, Senator Hoylman's bill, which would, for individuals who are 55 or older, once they've completed 15 years of their sentence, then they need to be able to go to the parole board and be considered for release into community supervision, regardless of their original sentence or previous parole eligibility. When I visit facilities, which is a very important thing, it's a privilege that we have as legislators to get to visit any correctional facilities in the state at any time. When we make these visits, I meet too many people who have been incarcerated for longer than I've even been alive. I meet people who are aging, who are in, the long-term care unit at Fishkill, for example. There's just no justification for those individuals to still be incarcerated. There's no justification for people to be dying in prison in New York State, and it doesn't need to be this way. There's especially no justification for it during a pandemic. These are really the people who are most vulnerable. And so I think that passing both of those bills would really go a long way in trying to reduce the population in facilities. And all of us who are legislators who have that privilege of being able to visit at any time, it's really a responsibility, I think, that we have, because it serves as a means of oversight. When I visit these facilities, I was just at Attica and at Albion last week. What I hear from people inside is that they knew we were coming because the staff started to behave differently and they started to actually do the things they're supposed to do. And so, it's a really important means of oversight. And, I think we also need to continue to fight as legislators for there to be stronger oversight in statute of the agency, because we really can't rely on just these random visits.
No, absolutely, Senator Salazar. And as someone who's formerly incarcerated, I know all too well the show and dance that goes on before someone who has influence and insight and could impact the facilities and by extension docs is coming to the facility. They clean the floors more, right? People are set up a certain way, right? The engagement with the incarcerated people there changes in different ways. So it's this song and dance that happens, right? When folk are visiting who are coming to make sure that things are how they should be. So thank you for that insight. And obviously the bills that you mentioned, elder parole, fair and timely parole, and especially in the case of Mark, as someone who was violated for a technical parole violation, the less is more bill as well to address those things are so very important, right? And especially during the pandemic and just generally speaking. Dr. Cohen, right, talking about like, you know, do you think like when you talk about the distrust of those who are incarcerated as it relates to medical staff and medical treatment, do you think that that distrust comes from a place of like racial, the racial experience of Black and brown people in terms of the current racial disparities within the US medical system, like generally speaking? I know Harriet Washington wrote a book called Medical Apartheid. And in that she looks at the historical experiences of Black and brown people vis-a-vis the medical community. And that's okay. Bobby Brown, this is not the SEC, so you're not censored for making sharing a curse word. So this is Zoom recording. But Dr. Cohen, again, just, you know, this whole notion, you know, do you think this distrust with medical staff is another example of the distrust from a racial perspective, right? In terms of like the current racial disparities in the US medical system. Dr. Cohen, have we lost you? And we'll circle back to just Dr. Cohen if he is.
Now I'm on, I apologize.
No worries.
Your question was about distrust. I worked as a doctor on Rikers Island, and I ran healthcare services on Rikers Island, and I was not aware that that was a critical issue. But now it is on Rikers Island in particular. Some of it has to do in the city jails right now with a sense that medical staff are treating officers rather than a person who are living there. And that's been brought to my attention on a number of occasions recently, and is of great concern. But I think that to the extent that that systems don't function, you know, as the state described in their own literature, that there are not enough clinicians to provide care to people, and there are lengthy periods of time to get seen, and perhaps for specialty care not seen at all, that breeds appropriate resentment and lack of respect for the medical personnel. I think that the general questions around COVID are not about the clinicians in the state prisons or the state jails, but go much deeper into concerns about racism in this country.
Thank you. And Alex, when you think about like some of the work that advocates have been doing, among social advocates in particular, what strategies worked and which ones do you think may not have worked as it relates to addressing this issue?
Well, you know, as I said earlier, I think that there hasn't really been any particular grassroots movement that has achieved anything really substantial related to the pandemic behind bars. I wish I could say otherwise. But if I could address what I think needs to be done, what ought to be done, I think it's important to tie what happens behind bars to what happens to the rest of us. I think that, you know, as a purely, you know, pragmatic and calculating matter, we can't just rely on people's sympathy for people who are locked up, because that sympathy is going to have limits. And, you know, sad to say that there is a limited number of people who are even going to allow themselves to feel that sympathy. And you know, that's the reality of our society today. So I think the more that we can connect what happens behind bars to what happens to the rest of us, the better we are. And I sometimes saw that in the reporting over the course of the past year, where they said, for example, in the Cook County Jail in Illinois, that's Chicago, it was responsible for an enormous percentage of the cases that developed in the city of Chicago. And, doing a very sophisticated statistical analysis, public health people can draw these conclusions. And of course, it wasn't just limited to Chicago. It happened all across this country. That's the kind of thing that I think really gets people's attention, because then it starts to chip away at some of the hardness they may feel toward people who are stuck in this system and whom they may have some fear of generally. But once they realize that, these are not other planets that we're sending people to, these are places where there's quite a bit of churn. There's a revolving door in a lot of jails just by their very nature. Then people will start to feel, okay, maybe as a purely practical matter, then we should be doing better with the care of people behind bars.
Thank you for that, Alex. And we're going to take one more round of questions from each of our panelists, then turn to some of the questions that we may have in the chat. And Mark, were you allowed to have visitors when you were on Rikers Island? If not, for how long? And did you experience or witness anyone be put in solitary confinement as a result of not refusing maybe to take the vaccine, et cetera?
In regards to visits, visits were stopped on Rikers Island by the time I got there. I got there December 8th, and I stayed there from December 8th till February 9th. There was no visits going on. I can't tell you exactly when they stopped that. But people were essentially, your visitor will have to call the facility, log on to some app or whatever, make an appointment, and then you go downstairs and you do like a video chat or whatever. So there was no physical contact with people from the outside as far as visitors or detainees' families. So that wasn't happening. In cases where I'd hear of people in the dorm who, they're not coming back because they have COVID or whatever the case may be, and which is scary. You start looking around at everybody at that point, right? And you're just waiting for symptoms to, for you to start having some symptoms, But it's very difficult because a person will complain of coughing or complain of something, and it just takes them so long. They want to just give you ibuprofen, they want to send you back to the dorm, and then it just takes so long for them to figure out what's really going on with you. And so, no, as far as solitary confinement, I believe where they were putting people is they were putting them inside of the infirmary. There's an infirmary where if you contracted COVID-19, you would go in that infirmary where people who may have broken legs or some type of illnesses are. And in that area, you are isolated by double doors and things of that nature. So, that's the extent of my experience from that perspective. Yes.
Okay. And Senator Salazar, this is like a 3-part question, and I don't mean to inundate you with 3 questions at one time, but obviously it has all to do with, you and your colleagues. Did any of your colleagues write COVID-related reentry legislation? And in writing some of that legislation, did it factor in some housing solutions for people coming out? Because the other thing, people needed housing, were being released early due to COVID-19. In terms of transparency from docs, I know you talked a little bit about that. What was that like for you? What sort of information you were receiving, and how did that impact your legislation? And then the last question about what legislation do you really think the state needs, right, within the correctional setting? So that's 3 questions. I hope I spoke clear enough for you, and I'll turn it to you, Senator Salazar.
Yeah, certainly. So during the peak of the pandemic, and then later this past fall, the legislature held public hearings on COVID-19 in jails and prisons. There was one in September, for example, and a lot of colleagues participated. And it was an opportunity for us to demand answers from docs and information that they hadn't been making available to us. Unfortunately, they didn't necessarily provide it to us then either, but the information that Anne mentioned at the beginning of this call is, mostly what we have available to us is the reporting on positive cases, the number of deaths, which thankfully there hasn't been, as far as we know, a death due to COVID-19 in a facility this year. But nonetheless, we only know what Docs is willing to share with us, and the agency has not been the department hasn't been very transparent about that information. But with the data that we have received, it's definitely informed legislation. Senator Bailey has a bill, for example, S7229, which would provide comprehensive discharge planning prior to the release of an incarcerated person from a correctional facility. Docs would need to come up with a plan, including housing, as you mentioned, which is absolutely critical. It's such a barrier to people being released into community supervision, not having adequate housing or housing that will accept them. Such a plan would need to provide for someone's mental health needs, their housing, their medical care, employment, any substance use disorder services that they may need. And the department would need to prepare that plan no later than 45 days prior to someone's release. This is critically necessary right now. There are people who have already even been approved for release, but who are still sitting in facilities because they simply don't have a safe place to go if they were to be released. And that especially goes for people who are receiving long-term care. So, I think it's really important that we pass legislation like that. In terms of, we also want to focus on reentry more broadly, beyond just the particular needs of the pandemic, and in visiting facilities, and then also obtaining some data for docs from docs on work release. It demonstrates the demand for us to pass legislation to actually expand eligibility for programs such as work release. Currently, under current law, docs has entirely the discretion to set regulations for work release, and as a result, docs does not allow every facility to even participate in work release programs. Just being at Attica, no one at the facility is eligible just because of the facility that they're at to participate in work release. And then, across the entire system, it's a very slim percentage of people who are participating in work release. And that's a shame, because it's a program that can be tremendously beneficial to people who are incarcerated and before they are released, even being able to work and earn more money than they possibly could working within docs in an industry within the facility. It's just a very important reentry program, and we know that less than 4% of people in the system are even able to participate in work release right now. So we really need to pass legislation that would set regulations and say that you can't bar people from participating for unreasonable reasons.
Absolutely, Senator Salazar. And obviously, with over 50% of the people who are leaving New York State entering shelters, it's critically important that people have access to housing. And I know that on the city level, the Fair Chance Housing Coalition is pushing legislation now to prevent housing discrimination with people who have criminal conviction histories. And I know that Councilmember Levin is moving that along, and we're now looking to engage Speaker Corey Johnson to support passing that legislation. So all of that's really fundamentally important to making sure that people, once released from jails or prisons, have access to housing without being discriminated against. We're moving along with time. We're doing pretty good, everyone. Got two more questions left for Dr. Cohen and one for Alex. And Dr. Cohen, very briefly, if you can just say, has there been any feedback from in-house facility doctors, like the on-site healthcare providers during the crisis, like what their experience has been in administering aid, right, relative to testing, vaccines, managing those infected with COVID, et cetera, right? I can imagine there's a toll and a lot of pressure too on those who are obviously administrators, the healthcare providers. Can you talk a little bit about that, if you've heard anything?
Can you hear me?
Yes,
Hello?
yes, we can hear you, Dr.
Yes.
Cohen.
I really haven't heard much of that. Most of my communications are with the senior level staff of correctional health services. I would just say that based upon my discussions with them, and I think they really tried to do a good job, but there were some serious issues. They were not providing enough testing. They were, and actually we got complaints at the Board of Correction from people living in the jails about lack of access to the results of their testing generally. And I think Mark's comments on access to testing and the testing of people who had been exposed to other people who with positive COVID issues were critical. I would sort of generalize that into everybody should know more about what's going on in the jails and prisons in every specific and general area. And in particular, there should have been and there should be nationally and at the state level. New York City is pretty good, but not as good as it should be with data transparency. It is critical to understand for the ability to understand the pandemic, how the responses are working, and how they're not working. I think it's of note that the CDC developed reasonable guidelines in general, but they did not but they specifically said, we know you can't do these because we're concerned with people who were in prisons and jails, and you're not going to release them, so you're not going to be able to provide 6 feet of separation, and that is inhumane and cruel on the part of the feds, and really affected what was going on, and allowed the medical staff to be comfortable in not advocating as clearly and as vociferously as they could for the necessary changes. I think data transparency, everybody believes in it, but particularly in people for people inside, it's very, very important for their families and for them to know what's going on.
Yeah, I've been taught that we lean on data for light. It's like a light post, right? You can lean on data for light, but it doesn't necessarily offer illumination, right, per se, right? There's a need to look deeper. So the data gives you some light, right, and some understanding, but to look deeper and to get at the root of it is where the real illumination happens. And so
Can I just add something there?
Sure,
What
sure.
the city, the city did not provide, and I don't know that anyone provided data on the seriousness of individuals' experience. For example, hospitalization rates. That should have been provided and was not provided. Death rates were provided, but death which occurred just after discharge because someone who was very sick were not provided. I don't know that that's a huge number of people, but anybody who was in a ventilator and number of people in hospitals would be a marker for the success of the care program that was being delivered.
Absolutely, and that's where the illumination comes in, right? Because there are other variables and other elements that make up what's happening and why it's so important. And so, Alex, right, turning to you, do you think the advocacy community's response to COVID-19's response in prisons is going to make any difference in the overall correctional system? And, after the pandemic has finally passed, if so, why not? And I know, you say you don't want to be the negative person necessarily, Alex, in this instance, but just some thoughts and reflections on that. Then we'll turn to our a few questions that we had. And then unfortunately, we'll have to close this part of the work in terms of this webinar, but the work will continue through all of our panelists. Alex?
Well, I like to think that nothing that we've done is in vain, even when we did not get the results that we wanted because of those, both human hesitancies and institutional barriers that I mentioned earlier, I still like to think that we have shown a light on the issue of just how bad conditions can be, particularly healthcare behind bars, and that we have shown an ability to litigate and to force the city or the state to answer our legal contentions, which, you know, if there's any kind of learning process going on in these legal departments, then they should be you know, thinking for the future. How do we prevent having to answer so many lawsuits? You know, they were cases large and small, but every single one had to be answered by either a city lawyer or a state lawyer. You know, for the future, really what we need is not necessarily better lawyering, but what we need is really a change in our public awareness and our political culture. You know, I'll just say one of the takeaways for me of this whole pandemic is the government response was too constrained by political thinking, and therefore it was too timid. Both the governor and the mayor had a kind of a set it and forget it approach. Like early on, they wanted to be seen to be doing something, and they put a few very minor programs in place, and then they really didn't want to deal with them again, even as the pandemic went into a second wave, and of course we all know it became more lethal in the winter. You know, really what we need to do is build more humane policies and practices into the system, because the system harms everyone it touches, even absent a public health emergency. So that's the challenge for all of us.
Thank you so much, Alex. And I want to thank all of our panelists for joining us. We do have maybe 3 or 4, either a statement or a question, one question. I'll read the first statement. It says, Senator Salazar, thank you for mentioning people still inside waiting on housing in order to come home. This is a horrible situation for so many people right now. Thank you for bringing it up and mentioning the bills we can support. That's from MK, I'll just say their initials. Another statement was made. My son is currently incarcerated in state prison. He has refused the vaccine. When I asked him why, he cites distrust of Doc's healthcare, the lack of choice in which vaccine to take, and the low vaccination rate of COs. The anti-vaccine attitude is passed along by them. What steps can be taken to address the reluctance of incarcerated individuals to receive the vaccine? This question was raised at 2:37 p.m. And I think Dr. Cohen may have spoke to that to some degree, but if anyone cares to respond to that really briefly, we have maybe like 4 minutes left, excuse me, unfortunately. So if anybody, like, what steps can be taken to address the reluctance of incarcerated individuals to receive the vaccine?
I'll jump in quickly and say that I can't emphasize enough education and constant education, providing it from people who are trusted sources by people who are incarcerated. I think it's valid and reasonable. The distrust toward some of the medical staff, unfortunately, you know, even though it is absolutely safe for people to receive the vaccine, the messenger can be the problem, and it sounds like that's part of the problem in this case for this person's partner who's incarcerated. So, you know, I think that there does need to be an opportunity for people who are trusted, community leaders, community-based organizations that already work in the facility, to be able to bring that message of encouraging people to get the vaccine, rather than someone who they don't trust, to be frank. So
Absolutely.
yeah.
Absolutely, Senator Salazar. And I think another question was about what was the protocol when there was a positive test. And I know Mark said that they were pulled into different spaces, like solitary kind of spaces with others who may have either sustained injuries to their body somewhere, their leg or something like that. And they were kind of quarantined off to some degree around that. That question was posed around 2:43 p.m. So I'm sure they probably heard that answer to that question as well. And then just a statement on August, someone said that they were, would mark 1 year of release from prison. The person served 40 years and was incarcerated when COVID hit. From March 20 until my release of 8/10, there was no social distancing, limiting or mask wearing until John Jay College sent masks into Otisville prison in June. So showing that John Jay College, some folks sent some masks into the prisons there to support the folk that were incarcerated. So those are some comments and some questions that we received. I don't know if there are any thoughts that others have, Ann or Rebecca, the rest of the team, but I really want to say that on behalf of the COVID Justice Coalition and the hundreds and thousands of women, men, and folk from our LGBTQI, gender fluid community who are in jail and prisons, we thank you, we thank you, we thank you, panelists, Senator Salazar, Dr. Bobby Cohen, Alexander Lesman, and certainly without but not least, Mark Lucas, who's directly impacted, who was on Rikers Island during the time of that. And as it's critically important that people who have been impacted by the criminal justice system's voices be elevated, we wanted to make sure that we acknowledge you, Mark, and thank you for sacrificing your time to tell your story. And that's really, really important. We will have more of this. Others will be obviously informed. And again, we thank everybody. We thank all of the viewers, all of those who stayed throughout the duration of this time. My name is Andre Ward again, on behalf of the Fortune Society too, and on behalf of all of the coalition members, we thank you. We thank Ann Kelsey, who's on, one of our leaders in the COVID Justice Coalition. We thank obviously Rebecca Engel, the Senior Policy Counsel of the Fortune Society, for her leadership in all of this. And we certainly look forward to all of you joining in coalition with us, joining in collaboration with all of the other state-sponsored legislative bills and city bills as well. Get involved, right? There are a ton of different other legislative bills that are out there that need to be passed as well on the city level, and we want you to get involved, all of us or none of us. So again, thank you so much for joining us. Be safe out there, continue to have a good day, and we will see you soon. Have a good evening.
Thank you, Andre. Thank you, everyone.